Hi there, my name is Rebecca Grube and I'm one of the certified athletic trainers here at Cerner, and this is David Albers. He's another one of our certified athletic trainers, and we both work on the Motion Health program. Thank you today for participating in the lower extremity workshop. This will be our very first out of a series that we'll do over the course of this next year. If you have not participated in the Assess Your Mobility workshop, I highly recommend you do that first, and then participate in the CARS workshop, which stands for Controlled Articular Rotations. That's kind of the basic level. Today we're going to focus though on the lower extremity, and specifically really in the mobility of the hips. In our practice of evaluating different injuries and patients that we see here, we notice that there are a lot of people that have knee issues and lower back issues, and in almost every individual that we assess, almost all of them have hip mobility dysfunctions. And really, I don't want to go too far into it, but if you're missing hip mobility, the body is usually trying to make up for that lack of motion somewhere, and it tends to go into the lower back or down to the knee to look for that extra motion. So we really find that this is a crucial aspect for everyone to work through and to pay a little bit more attention to. Also, if you think about the activities that we do every single day, walking, running, sitting, standing, so much of what we do is in this kind of flexion, extension, or forward, backward motion. And we are really lacking, generally in our society, that rotation of the hips. And that's really a crucial part to maintaining good joint health. So we're going to go ahead and get started with our first exercise. And this is called the standing hip CARS. So if you did the other CARS workshop, you'll notice that we did a hands and knees controlled articular rotation. So this is just a little bit more of an advanced version of that. So you're going to start by standing next to a wall. This is not a balancing type of exercise. And we're going to work the outside hip first. So first thing you're going to do is pull your knee up into your chest. And then you're going to release and maintain tension in that arm, rotating the leg out to the side. And then you're going to rotate the leg so that your lower leg is parallel to the ground. Really extend the leg back behind you. Really bend that knee and pull the leg through. And again, pull the knee up into the chest. And again, you're really trying to achieve or move your hip towards the outer limits of your range of motion, really noticing where are your particular restrictions and moving into that space. When you move into that space, you're really stimulating a lot of the joint fluid production that are in the connective tissues that surround the hip. Okay, we'll go the opposite direction now. So you're going to bring your heel up towards your glute, release, generate tension in that arm, extend the hip, bring it out to the side, rotate, and pull the leg up in front, and lower. One more time, heel up towards the glute, release, extend, knee out to the side, rotate, bring the knee up in front, and lower. Switch sides. Okay, bring the right knee up towards the chest, release, rotate out to the side, rotate so the lower leg is parallel to the ground, bend that knee as you extend the leg back behind you, and pull through. And again, up into the chest, rotate. It's a pretty tight, sticky corner right here. Just work through it the best you can and pull through. And then reverse direction. Bring the heel up towards the glute. Release that arm. Bring the leg out to the side. Rotate. and pull in front of you. And release. And again, last time. Release that arm. Extend out to the side. A lot of control is required here. Rotate that arm and pull down. Good job. It's a tough exercise. Just do the best you can. As you continue to do this consistently, it will get a lot easier for you. You can see we're both breathing a little hard, so completely normal. Okay, we're going to move to the ground. Left leg is going to be in front, and we're going to get into that hip 90-90 position. So again, if you did assess your mobility, this should be a familiar position to you. Left leg, left thigh should be perfectly straight in front of you. Right thigh perfectly straight towards the wall to your side. And then 90 degrees at your knees. So pretty open here. You're going to draw your chest forward until you feel a stretch in the back of the left hip or hamstring. Sometimes people will feel it a little bit in their lower back. Again, if you remember in Assess Your Mobility, we talked about how this was a great, not only assessment tool, but a really great first step in achieving your treatment plan or achieving greater mobility. So you can actually sit in this position for a couple of minutes. We're not going to do that today. What we're actually going to do is something called pails and rails. And that just is an acronym for an isometric contraction. So we're going to press our lower leg down into the ground for a 10-second contraction. And then we're going to contract everything on the top of the leg to almost pull the knee up off of the ground. I'm going to have you place your hand on your lower leg so that you're almost pressing into your lower leg or into your hand for a 10-second contraction. We'll go back and forth a few times and then move on. Okay? So again, find that stretch, pressing the knee down to the lower leg, into the ground, ready and go. You're starting at 20% effort. You're going to ramp up to 40, 60, 80, really pressing into the ground for 100% for 3, 2, 1. Now you're going to kind of press up into your hand, 20% effort. Start out slow, we ramp up, 60, 80, 100% for 3, 2, 1. Reverse the contraction again. Knee down to the lower leg, into the ground. Ramping up effort here, 40%, 60, 80, 100% for 3, 2, 1. Back up into your hand, really contracting the inner thigh, ramping up effort, 60%, 80, 100% for 3, 2, 1. Last time, both contractions. Press the knee down through the lower leg. When we get up to 100%, your leg should be shaking. 80%, now that 100% for 3, 2, 1. Last time, up into the hand, really contracting that inner thigh, ramping up effort, 80%, 100% for 3, 2, 1, and relax. Take a couple of deep breaths here. Sit up straight. And the next thing we're going to go into are a couple of hovers. So we're going to lift up the back foot, and then we'll also lift up the entire leg. So a couple of things you can do here with your hands. You can press your hands through the floor to generate tension. If you're pretty comfortable sitting in this position though, I would suggest that you hold your hands in front and generate tension here. Okay? So we're going to go ahead and get started. Again, lifting up just that back foot up off the ground for 3, 2, 1, and relax. And if you're getting a hip cramp here, that's pretty common and normal. So just work with it. And again, lift, 3, 2, 1, and relax. If you find that this front knee wants to come off the ground, you can always place a small ball under there to keep the knee down. And again, generate tension here and lift that back foot. 3, 2, 1, and relax. Now we're going to lift that entire leg off the ground while trying to keep this front leg on the ground. Okay, generate tension through the floor and lift. 3, 2, 1, relax. And again, lift, 3, 2, 1, and relax. Last time, really developing control here in the hips. Lift, 3, 2, 1, and relax. Now we're going to go into a little bit of a rotation. So I want you to try to keep this front knee on the ground as much as possible, and we're going to rotate this back hip. So you're going to pivot over this back foot, maintain tension here, and just lift up this back knee as high as it'll go, really contracting the hip, and relax. And again, pivot that back toe, and lift that back leg for 3, 2, 1, and lower. And last time, pivot over that back foot, raise that back knee, 3, 2, 1. Keep going this time. I really want you to open up all the way. And David and I are going to pivot a little bit towards an angle so you can kind of see what we're doing. So here we are maintaining external rotation of both of our hips. Our feet are also externally rotated, so they're pointing outward. And this is a really great position for working on the flexibility of not only the inner thigh, but that control of the outer thigh. So from this position, we're actually going to pivot over our right foot and try to bring our right knee down towards the ground. You'll see that I'm trying to maintain my torso forward facing. Go ahead and open up that knee and pivot over the left foot, bringing that knee down towards the ground. And I want you to just repeat this for 2 more times each side, nice and slowly with control. Now you'll notice with some people that this is uncomfortable for the knee, and usually that indicates a lack of mobility in the hip. So we don't have a whole lot of motion in the hip maybe, and so our body's looking for that extra motion and stressing the tissues out in our knee. So just take this to the point that's most comfortable for you. Usually once I have really worked on my mobility, at the end of a session, my knees will be able to hit the floor pretty easily. Okay? And open back up. And now we're just going to go ahead and do everything we just did on the opposite side. So let's go ahead and bring our right leg in front to the right side, 90-90. Okay, so find your position again. And this time, you're again going to just draw your chest forward, looking for a stretch in the back of that right hip. Okay. Once you do find that stretch, we're going to go ahead and start that pails and rails contraction again, pressing the lower leg into the ground, and go. Ramping up effort, 40%, 60, 80, 100% for 3, 2, 1. Now you're pressing up into that hand, really contracting the inner thigh, ramping up effort, 60, 80, 100% for 3, 2, 1. Reverse the contraction, really trying to press the knee down to the lower leg, even the ankle into the ground. You're ramping up effort, 60, 80, 100% for 3, 2, 1. Up into the hand again, ramping up effort, 40, 60, 80, 100% for 3, 2, 1. Pressing down into the floor one last time, really trying to press something else down into the floor you didn't before. 80%, 100% for 3, 2, 1. Last time into the hand, ramping up effort, 60, 80, 100% for 3, 2, 1, and relax. Take a couple deep breaths. Come upright. If you feel like you're not able to, if you're not feeling this muscle contract the way that I'm kind of talking through it, that's okay, and that's really pretty normal for the first couple of times that you do this particular exercise. These muscles in this particular position probably don't have the control that they should have. So that's kind of what we're working towards. Eventually that control is going to come and that responsiveness is going to come of that muscle. Okay, so we're going to go into our hovers again on this side. So find your point of generating tension. We're going to lift up that back foot. Ready, go. For 3, 2, 1, and lower. And again here, you want to try to maintain an upright torso. Even if you have to put your hand on the ground, just try to maintain as upright a torso as you can. And lift up. 3, 2, 1, and relax. And then last time, lift up. 3, 2, 1, and relax. Now the entire leg. Again, you can press to the floor or have your hands here. For an extra challenge, you can even put your hands behind your head. And up. 3, 2, 1, and relax. And again, generate tension. 3, 2, 1, relax. And last time. 3, 2, 1, and relax. If you're unable to lift your leg, either the foot or the entire leg, again, don't be discouraged with that. That's also pretty common the first couple of times you do the class. That's going to come in time. As you get stronger, as you get more control, as you get more mobility over the hips. We're going to do our rotations on this side. So generating tension here, try to maintain contact with this front knee with the ground. Pivot over that back foot and lift the left knee up and hold. 3, 2, 1, and relax. And again, pivot and open. 3, 2, 1, and relax. Really push yourself here. Really contract the muscles in the hip. Last time, pivot and open. 3, 2, 1, and continue to open until you come into that fully externally rotated position. Again, I'm going to go ahead and pivot this way so you can see what we're doing. And lean back, pivot over that right foot. Maintain forward facing torso here. And open. And continue this a couple of times on each side. Hopefully you'll have gained a little bit more flexibility. And as you participate in this workshop more consistently, you'll notice an even greater improvement in your mobility. Okay, so to wrap up, this again was really focusing on your hips, working to maintain, not maintain, but improve mobility and greater motor control in your hip joints and in all the little connective tissues that surround your hip. If you had some pinching pain or significant pain for any reason during any of these exercises, feel free to reach out to one of us. Our information can be found in the document that's attached to this workshop. And for more improvement in your mobility, I highly recommend that you do this workshop multiple times, even a couple of times a week, indefinitely. Thanks for participating and have a great day.